California health officials ended the state's regional stay-at-home order on Monday, saying the latest projections for intensive care unit capacity allowed the restrictions to be lifted. The order applied to the Southern California, San Joaquin Valley and Bay Area regions, which are home to more than 90% of the state's population of 39 million people. The 4-week ICU projections for these areas show enough capacity to exit the order, according to the California Department of Public Health. All 58 counties now return to the state's tier-based system, which places each into one of 4 color-coded tiers indicating which activities and businesses are allowed based on local coronavirus case rates and test positivity. The majority of counties are in the strictest, or purple, tier. Most indoor businesses remain closed, but many can open outdoors with modifications, including restaurants, movie theaters, places of worship, and family entertainment like mini-golf. Personal care services, like barbershops, hair and nail salons, tattoo parlors, and piercing shops, can open indoors with modifications. Retail businesses are limited to 25% capacity indoors. Under the regional stay-at-home order, personal care services and movie theaters were closed and restaurants were limited to takeout and delivery only. Schools in the purple tier must offer remote learning only, but can reopen for in-person instruction after a county has been in the red tier for at least 2 weeks. Individual counties, however, have the authority to set their own restrictions and can choose to keep the tougher restrictions in place. California residents can check the status of businesses and activities in their county on the state's coronavirus website. California is slowly starting to emerge from the most dangerous surge of this pandemic yet, which is the light at the end of the tunnel we've been hoping for, said California Health and Human Services Secretary Dr. Mark Ghaly. 7 weeks ago, our hospitals and frontline medical workers were stretched to their limits, but Californians heard the urgent message to stay home when possible, and our surge after the December holidays did not overwhelm the healthcare system to the degree we had feared. The ICU capacity projections are based on 4 factors: current estimated regional ICU capacity available, a measure of current community transmission, current regional case rates, and the proportion of ICU cases being admitted, according to the Governor's Office of Emergency Services. The Bay Area region is currently reporting 23.4% ICU capacity, but it had remained under the stay-at-home order because of a 4-week projection of decreased hospital bed availability. The worst-hit regions of San Joaquin Valley and Southern California are currently reporting 1.3% and 0.0% ICU availability, respectively. San Francisco Mayor London Breed said in a tweet that the city will be in the purple tier.